Well, thank you everybody for tuning in. And we have a great panel discussion today around prostate cancer and prostate cancer awareness. We've got three awesome members of this panel to discuss all kinds of issues related with prostate cancer, and we're excited to have them all. First, we'll start with Dr. Manas Jain, and he's a board-certified urologist. He's been with Harrison Health Partners Urology Clinic for 15 years, and they're affiliated with CHI Fanciscan. And he's joining us today for his expertise, his knowledge on cancer, prostate cancer prevention and awareness. The other two gentlemen, Rick Griffin and Dave Sims, are colleagues of mine. Rick Griffin was the trainer for my 12 years with the Seattle Mariners, and he's got a lot more years logged than just those 12 years for sure, and has remained on with the Mariners as head trainer emeritus. Rick, we're really excited to have you, and thanks for being here. And Dave Sims, also a colleague of mine, a partner in a different way in the television and radio booth. Dave, we've probably spent similar amount of time, 12 years or so together. We had the distinguished pleasure to call Felix Hernandez's perfect game, and what a memory that was. We'll never forget that one for sure. So super exciting. But thank you all for being here and being a part of this. We're excited to hear and for folks to understand what is behind prostate cancer, some of the symptoms, and then also hear some of your stories that involve you and prostate cancer as well. So Dave, I'm going to kick it off to you. I know that September is Prostate Cancer Awareness Month. Can you tell us a little bit why this is also important to you?
Well, real easy. It saved my life. I found out that my PSA was out of control because I had applied back in September of 15, another insurance policy. Get the results back right before Thanksgiving, and the PSA number was up. And I hadn't done a recheck with my physician in the middle of the year like I had thought I was going to. Anyway, long story short, the number was up, and went in and had some tests and said, we got an issue here. And thank you. And this is while I was back home in New York, and we got it taken care of. And Doc, I can't say enough about the guys in your line of work. God bless, man. Basically saved my life. And we went in, did all the testing in December, and had the operation in January. And I got to spring training on time in March of 2016. And, I had some after effects, but I'm functioning well now. I'm thrilled with that. So, Doc, I'm a big fan of guys in your profession. So I've never met you. I'm seeing you now. I just want to, hey, big kudos, my man. God bless for all the work you guys do. The findings, the scientific findings that you guys have done over the years, and the robotic surgery was the thing that, it got it out and took care of it. And here we are.
Well, thank you, Dave. And I know, Rick, you as well have a story that involves prostate cancer. Why don't you share your story and what you experienced as well?
It's to echo Dave's thoughts. It's amazing the amount of care and the expertise that the physicians have, and the lengths they go to make sure that you get the proper care that you need. And prostate cancer is a lot different than other cancers because it's kind of silent. Unless you have symptoms or you get a blood test and go see a physician, you may go to the point where it's too late to actually get anything done, and then you're in trouble. And my situation was like yours, Dan. Every year in spring training, I got a physical, and part of that physical was a very extensive blood test. And I was slowly watching my PSA go up to the point where in 2017 in spring training, it was a little bit alarming because it made a big jump. And so then I went and saw a doctor down in Arizona, a urologist, and then I had a whole bunch of tests done. Pretty much every test you can have done to find out if you have prostate cancer, I had done over the course of spring training. And what I would do is when the team would go on the road, I'd go see these doctors and get biopsies and get MRIs and ultrasounds and different tests done. And then right at the beginning of the season, then I found out I had prostate cancer. So that was a really big shock for me because I had been so lucky with my health. I'd never been hurt. I don't get colds. I have never been sick. I've never missed a day of work or school or anything from being sick or injured. So to go from that to all of a sudden finding out you have prostate cancer, it was kind of a shock in a way to go through that. But I had my prostate removed and started on the way to mending.
Well, I know that the Mariners and CHI Franciscan have really teamed up, and Mariners Care specifically really trusts that CHI can keep our fans and their families healthy. And Dr. Jane, I think I'd want to turn this to you, and if you could just kind of spell out for us as sort of a representative of CHI, what are some of the signs and symptoms that you see people, undertaking when it comes to prostate cancer?
So, as Rick had mentioned earlier, there isn't very many signs or symptoms. And that's the scary part about prostate cancer is the best way to detect prostate cancer is based on that PSA test and a prostate exam. So the vast majority of patients that we diagnose with prostate cancer don't have any symptoms. And that's why it's so important for you to see your doctor once a year, get the annual physical, get the PSA test to make sure that you're not an asymptomatic carrier of prostate cancer.
And that's what kind of brings us to now. Like here we are, 2020. There's a pandemic. Folks are a little bit more apprehensive about going to see their doctor during this time. COVID-19 has really changed those risk factors. How do you, what would you suggest, and what can folks do during this particular time as well?
Well, I mean, what I tell my patients is that, cancer doesn't care if there's COVID pandemic going on right now, or your heart doesn't care if there's a COVID pandemic going on right now. Those things are still actively happening. You can still suffer from those things. Those things don't take a break. So it's important for you to continue to maintain those appointments. Now you can do them in a safe manner. If your physician offers Zoom visits, for example, like what we're doing here today, you should take them up on that. We're doing a lot of safety protocols within our office where we wear a mask. Everyone wears a mask. We do routine temperature checks. There's a questionnaire they have to fill out before they enter. So we're also trying to create a very safe environment if you have to come in person. So I tell all my patients, if you're able to come in, come in. If you can't come in, try to take advantage of a Zoom visit, because I think it's really important to, I understand there's a pandemic going on, but there's also other diseases that you may be facing that may not even be symptomatic that you need to have addressed.
Great. And Dave and Rick, I'll direct this question to you. Many men say that they're uncomfortable getting exams and getting checked for prostate cancer. Can you guys just both touch on why it's worth having a DRE procedure done, pending someone's risk profile?
I just think you need to get it done. I mean, listen to people who have gone through this. I can remember there was a story about the late, great Vince Lombardi. And this, of course, this is like 40 years ago. But he says, well, I'm not going to have anybody stick his finger, and one of his players who was at his deathbed said, hey, coach, if you'd done that, you might not be here at this time, Right. So, I remember hearing that story from a long time ago, and I made sure that, when I go through my annuals, 2 seconds, boom, bang, and then you get the PSA, you get the blood test, and you go from there. And Doc, you probably, I'm sure you've gone through that a million times.
Well, I don't like the exam either. I mean,
there you go. I mean,
but it needs to be done. And as you said, Dave, it's very quick. It's very quick. It's over before you know it.
Like Dan, I had the pleasure of having the same physician do it for about 20 years. So we had we were very close. I didn't have to go into somebody I didn't know. And so that made it obviously a little bit easier. And I probably had it at least 20 times done. I started doing it when I was, I think, 35 years old. And our doctor at the time did it on everybody. But because of risk factors and certain things, he did a lot of our people that may have not normally been done. And it's really, like you say, it's over quickly. It's not that big of a deal. And it definitely it gives the physician an opportunity to get more information to possibly guide you in the correct direction, which that can be the first thing to say he's suspicious, which then he would order a PSA or a blood test. So it's an important component, an important part of the overall process of trying to help determine whether or not you, in fact, could have prostate cancer. So it's vitally important.
And Doc, when I found out that I had, I remember my doctor told me, he says, hey, you're right in the demographic, in my 60s, African-American, our numbers are twice as bad as white Americans. I think it was, what was it? Like 1 in 4 as opposed to like 1 in 7 or 1 in 8. So
Yeah.
I heard that number. That scared the heck out of me. So hey, Doc, whatever we got to do, let's do it.
No, absolutely. I mean, our guidelines say after age 50, everybody should be screened. And if you're African American or have a positive family history in your 40s, you should be screened. And so that involves prostate exam and PSA. And what I tell patients, if you're totally scared, totally freaked out about the prostate exam, well, at least come in. Let's have a conversation about it. If you don't want the prostate exam, at least let me do the blood test. At least get the blood test done. The comprehensive evaluation involves the prostate exam, but if they refuse to come in and they're too scared to come in just because of that, I would encourage them, at least we can do a blood test.
So Dr. Jane, back to you. So who are the types of people that should be getting screenings and how often should they be getting screenings? Can you talk a little bit about that?
Yeah, Dan, I think everybody should get screened after age 50. And then if you're in your 40s and you're African American or have a positive family history, you should be screened. And that involves getting a digital rectal exam and a PSA blood test. And you should do it annually. Some do it every other year, but at least once to every 2 years is how often it should be done.
Well, my whole thing is, I think the doc nailed it. There's nothing to be afraid of.
Yeah.
There really isn't. And I tell you what, the peace of mind you're going to have walking out of the office, you either know you have it and you can attack it, or you don't, and you're like, hey, I'm gonna go have a cocktail right now. I mean, it's one of those kind of things. You just want to know.
And kind of to piggyback that on that, Dave, the other thing I get a lot about is that patients say, I don't want to lose my erections. I don't want to have surgery. I don't want to have radiation treatment. The thing with prostate cancer is many times we don't have to treat it. We can just monitor it and follow it. And I think, again, that's part of that peace of mind piece of it. It's very important to know if you have it, to know what we're dealing with, and then we can monitor it. We don't necessarily have to treat it. And I think that's also a really important component about prostate cancer.
Rick, any parting shots for you?
No, I agree with all of those comments. It's just, you just have to be very proactive. You have to take care of yourself, and you have to understand that every person, every male has the possibility of getting prostate cancer. And when you get a certain age, 45 to 50 years old, you need to make yourself aware of that possibility. And you have to take the necessary steps to find out as soon as you possibly can if you do have it, so that you can prevent anything from spreading or getting worse. So it's just be very proactive. That's my big message is, take care of yourself and be proactive.
Well, I think that's a perfect segue in that the Mariners are really encouraging their fans to make a pledge to get back to their health and encourage their family members to get back to their health as well by really getting into their annual wellness checks and screenings. Even during this time, if you're uncomfortable, at least schedule that virtual visit with your doctor to get a check and see and give them a call and find out what CHI Fanciscan is doing during this time to make visits safe. And I just think it's a really important time for all of us to make that pledge and get back and recommitted to our health. So with that, Doc, Dave, Rick, really appreciate this. Really appreciate your perspectives on prostate cancer and prostate cancer awareness. And we really appreciate your messages. And thanks for joining us today.